Hadi Denise Zakase Gajin Kwa Nanano Aton Tapi Hanzu. Carrie Sekani 2006. They borrowed me for 6 weeks, and this is, I think, my 12th year. And the best memory I have is working with Warner. Warner always, he believes in the workers, and he uplifts us, and he encourages us. There's never a time that I didn't feel I didn't belong, like a work family, and I really appreciate that. So I raise my hands up to you, Warner. I love working with Carrie Sekani. It's like a little family. And working with the youth at risk and the children in care. Thank you, Mary, for giving me that opportunity as well. And also working with the communities, with the CHRs. So I have many fond memories with working with a lot of our own member nations. My greatest memories is working in the communities with our member nations. It just fills my heart. And so I give thanks to Warner again for bringing me back home. It was Perry and Warner who wanted me home, saying that I should come back to Prince George and work with our member nation. I'm one proud person to be a First Nations person working with the Sekani Family Services.
I worked there almost 18 years. I started off as Stelako at Notley first as a community health nurse. And I think I was there for a couple years. When I got the offer of my life, I couldn't believe it. I thought, me, little me, you know. They said, Sarah, we're going to give you the community health nursing program development. We want you to develop that program for Carrie Sekani because they're getting funding for that, eh? I said, number one, I'm a First Nation woman from a First Nation band. I'm going to start culturally first. I'll say, I know all the protocols and policy for all the mainstream policies of the hospital healthcare system. So you know what, I'm just going to, my big job is going to be adaptation of all the First Nations culture into that policy. There may be a little bit of friction between the policy applying, but I'm going to do it anyways. And that's how I started. And I trained most of the home support workers, and again, I really put the cultural emphasis first. The other thing is I end up doing the home and community care program for about 11 years. I see Carrie Sekani has, since I started way back in 2002, I see many, many changes for the good. And I see the staff expanding. People are more, they're hiring more people with advanced education, which is really good to see. And more of our people are going into the social services program, like healthcare program, more so with social worker program. Eh? I still maintain my dad's words where, you know, you always have to have good education in order to have a good job. I still abide by his words, and I'm really encouraging all First Nations people, whether they're men or women, young men or women, to go into the healthcare professionals and healthcare careers. It's very rewarding, and it's a challenging job. I did it for 51 years, so you can do it too.